Hello everyone, this is Dr. Shawn Pourgol. I'm President of National Academy of Osteopathy, and today I want to speak with you about what type of table is the best fit for manual osteopaths. Every profession uses different type of tables, different heights of the tables. Chiropractors use knee-high because they focus mostly on manipulative techniques, manipulations, HVLA technique, high velocity, low amplitude. Physiotherapists use hip height, the height of the hips, because they do a lot of modalities. Massage therapists as well, they do a lot of soft tissue. The same with naturopaths, they do a lot of soft tissue techniques, and they use hip high because it's easier to do. But manual osteopathy is like the grandfather of all manual therapy health professions. It includes all their techniques. Almost all manual therapy professions in North America originated from osteopathy, chiropractic, naturopathy, the manual therapy techniques of massage therapy and physiotherapy. Many of them have roots in osteopathy. So one height does not really fit well into manual osteopathy practices. Even though most manual osteopaths in Europe and elsewhere use hip height tables, like the size of the length of the height of their hips, but I have a better solution for that, and I feel it is better, and my students use that as well, and that is to buy a high-low electric table. These are tables that you can adjust the height, bring it high or low, depending on the techniques you wish to practice. It's through electricity that moves it. They have electric motor, but they also have the manual ones that you can use your hands, but I don't recommend those. I think these are the best way for manual osteopaths to adjust their height when they're doing techniques. These tables cost about anywhere from like $1,000 to $5,000 on average. There is even one company in Toronto that makes one specifically for osteopathy. I forgot the name, but we have about 5 of their technique tables, osteopathy tables at our York University Heights campus in Toronto. If you Google it, you will find the name. It's a table specifically built for us manual osteopaths, and the name is osteopathy something for the table as well. Because our patients lay for 1 hour, we need to have the table become more comfortable for them, so there is more cushion in it, as opposed to, for example, a chiropractic table that the patients don't lay down so long there, and because they do manipulation, they need the table to be stiff and harder, as opposed to ones used by massage therapists or manual osteopaths. This is what most of my patients use, but I also recommend something else, a high-low electric table that also has a traction built in it. We have a lot of traction techniques in osteopathy, which is good for disc problems, posterior facet joints problems, and so on. But this table, you can put the patients on, and for a few minutes the table does the traction, so it saves you time and energy. So it is something a little more expensive, but it's an option for you. I highly recommend it. If you do plan to buy a traction table, high-low electric traction table, don't spend more than $20,000 on it. They have anywhere from like $2,000 to $20,000 good solid ones, and they have like super expensive ones up to $200,000, which is I don't think is worth it. The job is just to do the traction, but it has TV and so many other bells and whistles that you really don't need. I don't recommend you spending anywhere more than $20,000. Chattanooga has a great one that the price is, I think, anywhere from $15,000 to to 20,000. It has lumbar and cervical traction, but I prefer only lumbar. I don't like cervical traction too much with the machine. I prefer cervical traction to be done by hands because it's a more delicate area, and I don't like to put the machine on all those braces and stuff for the cervical traction. So this for me, I think, is the best, and I think chiropractors and others also can use high-low electric table. It is very good for them. If they want to do different type of techniques, for example, PNF techniques, muscle energy techniques, and those you need to bring the table higher. This is an excellent way for them to move the patient up and down to make the treatment easier for them. That's it for today. Thank you for watching this video once again. I'm grateful to God. Thank you, God, for allowing me to come to Spain to see all this beauty around me. God has created all this beauty for our enjoyment. Wherever you are, I pray for you to have a happy, healthy, wealthy day. Hasta luego. God bless. Namaste.